The health emergency disaster due to the spread of the novel Wuhan coronavirus, also known as COVID-19, is a type of influenza, and it continues to bring challenges and new forms of communicating, ways of doing business or not, and general altered living conditions, as a stay-at-home order means that everyone's life has changed this spring. DCTV Daily News and partners continue to work diligently to bring you the latest information and how this impacts you, the community. Wash your hands, stay well and strong. I'm Kendra Cook, your host for the DCTV Daily News program out of Dove Creek, Colorado. The Dolores County Broadcasting Network is the producer of DCTV with support from the Southwest Colorado TV Translator Association. That's the special district association responsible for bringing the area free-to-access TV stations over the air by antenna. This is a community TV station. If there's a news story or event information that you would like to share, you can call us at 970-677-4119 and leave a message. And if you're a business or organization, we welcome you to find out about sponsorship opportunities for banners or video segments run on the channel. This is the Thursday program for April 9th, 2020, DCTV Daily News. Reported from the Idaho Statesman, it's now national news that a county in Colorado is serious about keeping outsiders out. Tourists are not welcome in a Colorado county during the coronavirus pandemic, and they could face jail time if they come. Gunnison County officials initiated a public health order last week that says non-residents and tourists must stay out to help slow the spread of coronavirus, and it comes with hefty consequences if it is violated, that according to county documents. If someone doesn't follow the public health order, they could be hit with a fine of up to $5,000 and spend 18 months in county jail, according to the order. The public health director finds that non-residents, visitors, and non-resident homeowners from lower altitudes are at a greater risk for complications from COVID-19 infection than residents who are acclimatized to the high-altitude environment of Gunnison County, the order said. The public health director also finds that non-residents, regardless of whether they own a residence in Gunnison County, are imposing unnecessary burdens on health care, public services, first responders, food supplies, and other essential services. Non-residents can request a waiver explaining why they need to stay in the county, Western Slope Now reported, or they need to leave as soon as possible. Our goal, quote, is to maintain the health and safety of our residents and the integrity of our healthcare system, Daniel Kreikes, Public Information Officer for Gunnison County Emergency Operations Center, told the Western Slope Now newspaper. To that end, there's some language in that healthcare order that allows for folks to apply for an exemption. We realize there are certain things going on with our residents that may require that. We want to give people that option if needed. And it's not the first time Gunnison County has shut itself off to visitors, though. During the 1918 flu epidemic, the county acted similarly, NPR had reported. When the isolated mining town saw the deadly Spanish flu sweeping across America, it imposed extreme measures, NPR's John Burnett said on All Things Considered. For 4 months, residents were forbidden to leave and travelers were turned away. Police erected barricades on the highway at Monarch Pass, just outside of town. At that time, people were arrested and put in jail, according to the news outlet. It was effective, though. Gunnison had no deaths, and neighboring towns lost 10% of their populations. As of April 6, there were 93 reported positive cases of COVID-19 and 1 death in Gunnison County, that according to the county records. The order didn't say how it would enforce or be enforced, or if county officials intend to follow through with the violations, Western Slope Now reported. There are more and more restrictions on personal mobility and access, even as the models for cases continue to drop off as our regular flu season also comes to an end. But for the greater good of overall health, these drastic measures continue to ramp up. We'll have more on that later in the news program. And now, let's take a look at our local weather. Today, mostly sunny on Thursday with a high near 57 degrees. Apparently, the precipitation has been blown out of our area. We have south-southwest winds at 10 to 15 miles an hour. Tonight, mostly clear and a low around 34 degrees, with south winds remaining 10 to 15 miles an hour, shifting southeast at 5 to 10 over the evening. For Friday, we're looking for a Good Friday sunny day with a high near 59 degrees, light and variable winds becoming south-southwest at 5 to 10 miles an hour in the morning. By Friday night, mostly clear again with a low around 33 degrees, with southwest winds at 5 to 10 miles an hour, becoming light and variable in the evening again. For Saturday, we have sunny days with another sunny day with a high near 61 degrees, light and variable wind becoming west-northwest at 10 to 15 miles an hour in the morning. For Saturday night, partly cloudy and a low around 36. And for Easter Sunday, a chance of snow showers before 11 a.m., then a chance of rain showers, mostly sunny with a high near 53 degrees. The chance of precipitation holds around 40% for Sunday. For Sunday night, a slight chance of rain showers before 8 p.m. and then a slight chance for snow showers, mostly cloudy and a low around 28 degrees for Sunday night. Looking into Monday, a slight chance for snow showers continues in the morning, but mostly sunny overall with a high near just 46 degrees, so we get cooler again. For Monday night, partly cloudy and a low around 24. For Tuesday, mostly sunny with a high near 48, and Tuesday night, partly cloudy and a low around 27. So we're going to have a nice weekend start, and then we head back to a little cooler springtime temperatures. And now back to the news. So the regular daily business must carry on for governments on all levels as much as it possibly can. From the Journal Report, update on election and voting in the town of Dolores. In the unofficial results of the April 7th municipal election, Dolores voters approved retail marijuana sales in town and voted against the use of off-road vehicles on town streets. Also, Chad Wheelis was elected to a second term as Dolores mayor with 65.7% of the vote. Wheelis received 207 votes to challenger Jerry Whitehead's 108 votes, or 34.8%. The winning candidates for the three positions on the Dolores Town Board are John Andy Lewis, 203 votes, Sheila Wheeler, 175 votes, and Val Trulson, 170 votes. The candidates who lost were Robert Cody Folsom with 162 votes and Kirk Swope with 145 votes. Voters were asked 6 yes or no retail marijuana questions, including 2 retail marijuana tax questions. The medical and retail marijuana stores questions passed, with 197 or 60.4% voting yes and 129 or 39.5% voting no. The medical and retail marijuana product manufacturing facilities question also passed, with 186 or 56% voting yes and 146 or 44% voting no. The medical and retail marijuana testing manufacturing facilities question passed with 188 votes or 57.8% and 137 at 42% voting no. The medical and retail marijuana cultivation facilities question also passed, with 171 voting yes, 52%, and 158 or 48% voting no. The 2 retail marijuana tax questions also were approved. The question on whether each marijuana sale should be subject to an occupation tax, that's a transaction fee, of no more than $5 passed, with 205 or 61.5% voting yes and 128 or 38.4% voting no. The question on whether there should be a 5% excise tax on the first sale of unprocessed cultivated retail marijuana to a retail store also passed, with 208 or 64% voting yes and 116 or 35.8% voting no. Dolores Town Manager Ken Charles said the next step for the town board is to develop the specific regulations, licensing, and policies for retail marijuana businesses in town. Other issues to be discussed are locations for shops and cultivation, and if there should be a limit on the number of retail marijuana operations. The process will involve public hearings and adhere with state standards. A preliminary goal is to establish the retail marijuana regulations for the town of Dolores by early next year, Charles said. OHV use in town voters rejected a measure to allow off-highway vehicles on designated public streets in Dolores, and that went down with 241 or 72% voting against it, and 92 or just 27.6% were in favor of allowing them. A total of 336 ballots were returned out of 718 sent out, representing a 47% voter turnout. And this is an opinion analyst piece from the Washington Times titled, Anthony Fauci sets stage for mandatory and lucrative vaccine. Cheryl K. Chumley writes, Anthony Fauci, America's most listened to medical professional on the coronavirus, and apparently on all the political, economic, cultural, and social precautions every man, woman, and child in the nation should take on the coronavirus, has just warned what cooler-headed coronavirus watchers have suspected all along, that this country may never, no never, go back to normal. Never, that is, Fauci suggested, until a vaccine is developed. And by logical extension, that's to say, never until a vaccine is developed that must then be included on the required list of shots for all children to attend school. What great news for Big Pharma. What great news for Bill Gates, who just announced his foundation is going to spend billions of dollars to help build factories for 7 possible coronavirus vaccine makers. Quote, spend is probably the wrong word here. Invest is more like it. After all, Gates first and foremost is a businessman, a billionaire businessman who made his billions in Microsoft and who just left his billion-dollar Microsoft enterprise to pursue other matters, specifically to, quote, serve humanity, is how the Economic Times put it in a March headline. For a taste of how he's already served humanity, one need only look to the disastrous Common Core, one-size-fits-all, top-down education plan that his foundation bankrolled. From education to vaccinations, the service to humanity never ends. But this is what Fauci's just warned at a White House briefing with reporters. Quote, when we get back to normal, we will go back to the point where we can function as a society. But if you want to get back to pre-coronavirus, that might not ever happen in the sense that the threat is there. But I believe that with the therapies that will be coming online and the fact that I feel confident that over a period of time we will get a good vaccine, that we will never have to get back to where we are right now. He also said this, if back to normal means acting like there never was a coronavirus problem, I don't think that's going to happen until we do have a situation where you can completely protect the population. This, as the dire, dark, deathly numbers that sent America into coronavirus panic in the first place were just revised downward. Quote, America's most influential coronavirus model just revised its estimates downward, the Washington Post reported. This, as Gates, the guy who has been the face of warning about the nightmare scenario of the coronavirus outbreak, just said the predicted death toll may not be as high as well predicted. Yes, viruses are, after all, seasonal. This, as deaths due to the coronavirus are widely open to interpretation, widely speculative, widely unscientific. The lack of widespread systematic testing in most countries is the main source of discrepancies in death rates internationally, the BBC reported. What do doctors consider a coronavirus death? Well, in the United Kingdom, health officials give daily counts of deaths of those who tested positive for the coronavirus, but who might actually have died from other medical conditions. In the United States, doctor discretion reigns. Quote, in the U.S., BBC reported, doctors are asked to record whether the patient dies, quote, as a result of this illness when reporting COVID-19 deaths to the Centers for Disease Control and Prevention. So some patients may have underlying conditions that lead to death or led to death. Others may not. Some hospitals may have policies that mandate the UK model to chalk up any patient who died with the coronavirus to be reported to the CDC as a coronavirus fatality. Other hospitals may let the doctor determine. It's a toss-up, hardly fact-based. And for all of this, America may never see a return to pre-coronavirus normalcy. We're focused on fear. And that's mostly the media's fault. A lot of it is. We should be focused on this, the money trail, the money and power trail. The Global Vaccine Action Plan, for instance, the World Health Organization, UNICEF, the National Institute for Allergy and Infectious Diseases, and the Bill and Melinda Gates Foundation have announced a collaboration to increase coordination across the international vaccine community and create a Global Vaccine Action Plan. The Gates Foundation reported in a press release. The collaboration follows the January 2010 call for Bill and Melinda Gates for the next 10 years to be the decade of vaccines. The decade of vaccines. It's a structured campaign. It includes a leadership council, a steering committee, an international advisory committee, and other bureaucratic so forths and so ons. But here's an interesting link. The leadership council is comprised of Dr. Anthony S. Fauci, the Gates Foundation reported. Fauci, the same guy who just set the stage for the dire need for a protective coronavirus vaccine, has a vested interest in seeing this vaccine come to fruition, come to widely administered fruition. Quote, "Vaccines are miracles," said Pedro Alonso, the director for the Institute for Global Health of Barcelona and another stakeholder in the Decade of Vaccines program. Yes, and for certain insider folk, vaccines are also great economic and political investments, especially when they come as saving grace solutions to widely spread fears, especially when they come as required, mandated protections for global populations. So this is another aspect of our current situation nationally and globally for a complete change of lifestyle in America. On a light note, maybe a red flag alien invasion wouldn't be so bad after all. Hang on to your seats. If nothing else, do not panic or be fearful. We all need to keep level heads and respond to situations with our core moral values leading the way. Deep breaths, one day or 1 hour at a time. So today's happenings or not category. There is a special meeting with the Dolores County BOCC that happened today at 1 p.m. on Thursday. One of the topics is to discuss with the BLM how access and campground closures are going to happen and be enforced. There were too many people headed to Bradfield, and this being Easter weekend, a lot of locals love to go camping. The Forest Service has already made access closures, so be aware before you think about driving anywhere. Again, going into Utah, Lake Powell, all the boat ramps are closed. Speaking of that, Friday night, there will not be a cruise or drag night in Dove Creek, once again trying to meet the details of the stay-at-home order that was given by the Colorado governor. This has been determined to be a no-go until further notice. That being said, here's a new restriction if you needed to go to Monticello for goods or services. In coordination with the Utah Department of Transportation, Governor Herbert issued an order on Wednesday requiring everyone who enters Utah by automobile or by truck by a major roadway to complete a travel declaration form. And that includes our access into Monticello on 491. This applies to all drivers over the 18 years of age and those whose final destination is Utah. The order will be implemented by this Friday, and the entry points which will be monitored include I-15 in St. George, I-80 entering the state from west and east, I-15 from Idaho, I-70 from Colorado, 491 from Monticello, and 89 by Kanab. The entry points listed above have geo-fenced areas so that vehicles entering the state will receive a text message from a federal system. Did you get that? Entry points will have geo-fenced areas so that vehicles entering the state on their phones will have a text message from a federal system pushed to them, according to Carlos Braceras, Executive Director of the Utah Department of Transportation. All this technology is something that we've been talking about for a long time, but it's fascinating that now when you have a crisis, we can move some of these in and people just accept them because we need to make sure that we stay healthy. When the vehicle comes to a stop, the driver will be directed to entry.utah.gov, that's the website, to fill out a self-declaration form. The form will ask if the individual was tested for coronavirus, the results of that test, and if they are experiencing any symptoms. It will also require basic information such as a name and where the driver traveled prior to entering Utah. It will ask about anyone traveling with the driver under 18 years of age. The driver will then receive a confirmation email when they have completed the form. The Colorado available data update for Thursday, April 9th, which is actually tallied the previous day at 4 p.m., we are showing currently 5,655 cases statewide, with an asterisk that says the number of cases includes people who have had a test that indicated they were positive for COVID-19. That sounds logical. And that the number of cases also includes epidemiologically linked cases or cases where public health epidemiologists have determined that infection is highly likely because a person exhibited symptoms and had close contact with someone who tested positive. The number of epidemiologically linked cases represents a small portion of the reported cases they state. Nevertheless, as we reported earlier, a lot of these cases, determinations, testing are all subject to variances. So now we have currently 1,162 people who are hospitalized in our state. It hasn't changed in recent days from the 54 counties having at least one infection identified, and that's out of 64 counties. And Dolores remains with no cases. Now they are reporting 29,299 people have been tested, and sadly there have been 193 deaths. And I'll continue to post up all of these happenings on our Facebook page, which is DCTV DCTV Daily News, where you can also watch this program replay along with the news links, stories of local interest, and you can share other events or news there and join in on the conversation. We'd like to hear your voice. Again, this is your local community TV station. So if you have something that you would like to share, contact us. The email is dcbnnews@gmail.com or call the station at 970-677-4119. Thank you for tuning in to DCTV Daily News. Programs are broadcast hopefully Monday through Friday. We took a break yesterday, Wednesday. I'm sorry about that. With replays online on our YouTube channel or DCTV Daily News on Facebook. And if you do like our program, please like and follow us on Facebook and share it with your friends and family. This has been a production of DCTV for the DCTV Daily News program out of Dove Creek, Colorado, USA. I'm Kendra Cook. And Friday, the courthouse will be closed, so there will be no program from the courthouse. I may be able to bring a program online from somewhere remotely in the county. Again, thank you for watching. I'm Kendra Cook.